underscored the fact that the project cannot be built in the absence of a give-and-take scenario. He envisioned that the meeting will enable them to access the necessary ingredients vital to the economic benefits of member states. At a time when the world is changing, the top ECOWAS official warned that no country can sustain itself without trade and also opening its doors to others. Calling for a thorough deliberation by stakeholders, Hamid Ahmed, ECOWAS's head of trade and free movement of goods, acknowledged that negotiations are difficult and that the conclave should be able to help tackle marginalization. Hamid also called for more support from EPA partners. The Minister of Trade, Industry, Regional Integration and Employment, Keba Esture, hammered home the significance of the meeting as he tasked the stakeholder countries to come up with a tangible strategy at the end of the day. He also pointed to the need to move forward as a community, not as an individual state, something he believes can undermine their development process as a region.
I need not overemphasize that 10 years is a long time in the history of our community. During this period, we have dedicated a significant quantum of time as well as human and capital resources to this process. But we recognize that these negotiations are key in our integration process and in redefining our economic relations with our key trade partners, the European Union.
With a significant amount of time at their disposal, Minister Toure urged the delegates to present results of studies conducted in their respective countries as well as propose solutions so as to drive meaningful outcomes.
Member states requested for more time and the Commission gave more time. But time is never enough. And I believe the time given was reasonable, even for bigger economies of the region, for them all to carry out conclusive, meaningful conclusions after this meeting.
As part of their 5-day convergence in Banjul, the stakeholders from the sub-regional economic bloc will endeavor to chart a way forward in the regional market access offer and the ECOWAS Partnership Agreement. Famara Fofana, GRTS.
Health personnel at Jammeh Foundation for Peace Hospital have been assessing the progress registered so far by the authorities. This as the international countdown to the 2015 deadline for the attainment of the Millennium Development Goals begins. Ibrahim Balde has that story.
Stressful for Sabtu Suwane and her colleague nurses at the Jammeh Foundation for Peace Hospital in Bundung. The peak periods are usually during weekdays when the demand for healthcare is ever challenging. With 2 years to go before world leaders reconvene with a view to looking critically at the progress registered, we went out and about to gauge the reactions of the health workers about UN MDGs.
As far as we are concerned here in Jammeh Foundation, we are working towards achieving the Millennium Goal 4 and 5, which is the reduction of maternal and neonatal death. Yes, at the moment there are ongoing trainings, there is capacity building, ongoing training on infection control, care of the newborn, maternal emergencies. We're doing all that to try and find ways of cutting down on maternal death and neonatal death. So there is that ongoing training going on amongst us here in the hospital. And sometimes the ministry they do organize workshops based on those training as well, maternal and neonatal child health. They are doing that to see that we achieve Millennium Goal 4 and 5. So we are working towards that and we hope to achieve it by the year 2015.
Optimism is the buzzword here, and Sabtu added that a lot has been done, arguing that she was optimistic about our commitment to achieving the UN MDGs.
We're working towards achieving MDG 4 because our maternal death rate has reduced, neonatal death rate is going down because of the ongoing trainings, commitment and the like.
The Gambia has over the years witnessed unprecedented developments in the health sector. With the Dongoroba Health Center in focus, many believe the more the merrier. Sabtu added that the construction of health centers in rural communities would undoubtedly help ease the pressure from patients who travel to the city for medical treatment.
So with the increased number of health facilities in these villages and catchment areas, it will go a long way in reducing the workload here because instead of patients coming all the way from Foni with health problems, they can be rather seen at their various facilities. If they cannot manage those conditions or health problems, they can be referred to major health centers or hospital, the main referral hospital Banjul. Or Brikama, even Brikama, they are doing operations now. So it will go a long way in cutting down the workload here.
The MDGs are the most successful global anti-poverty push in history.
At the United Nations, Secretary General Ban Ki-moon's statement is meant to spur member nations to move faster and deliver on their promises to reduce poverty and improve the health conditions of the peoples.
World poverty has been cut in half. More girls are in school. Child mortality has dropped. We are fighting killer diseases. The list goes on. But too many women still die in childbirth when we have the means to save them. Too many communities still lack access to sanitation. Too many families are still being left behind. We have 1,000 days to close the gaps, 1,000 days to accelerate action. Here are 4 ways to step up our efforts. First, scale up success through strategic, targeted investments in health, education, energy and sanitation. Above all, by empowering women and girls who can boost results in all other areas.
It's not going to be easy, however. With hard work, these goals could be met even before 2015.
Well, normally hospitals in sub-Saharan Africa are almost overstretched with the sheer number of people who on a daily basis knock on their doors to receive treatment. The situation might not be as different from that of Jammeh Foundation for Peace Hospital, where we understand the numbers are also increasing as a result of the services being provided here. The good news is that the nurses here are also optimistic about the chances towards attaining the Millennium Development Goals which concerns health. Ibrahima Balde reporting for GRTS at the Jammeh Foundation for Peace Hospital in Bondo.
We'll be back with more stories after this break. Need to quench your thirst? Then think Yandi. With flavors that are irresistible, whether cola, orange or cocktail, Yandi has it all to make your day feel good. Welcome back. For years, the people of Somalia's capital learned to do without it. They had no security, not even a workable government. But now the capital, Mogadishu, has something no one would have thought possible a few years ago. They have fine dining. Nima Eberji looks at a Somali chef who is making a difference, one mouthful at a time.
And on Mogadishu's main waterfront, families have come to enjoy the balmy waters of the Indian Ocean. Girls splash as boys strut and show off. Amid the rubble of the abandoned colonial-era villas, new developments are emerging. All unthinkable a year and a half ago when the Al-Qaeda-linked militant group Al-Shabaab controlled vast swathes of the city. Over at the village restaurant, this is the busy time for chef and owner Ahmed Jamal. When he first came to Mogadishu 5 years ago, though, it was a very different story.
When I opened this restaurant, they could not play. Someone going inside in this place and he's going to have a restaurant.
In Mogadishu?
In Mogadishu.
During the war, at the height of the war?
This was a front line.
Where we're standing right here?
Yeah. This was the grave area. And no one goes on.
Today, it's one of the most popular places in town. One of 5 restaurants, all called The Village, owned by Ahmed.